You know, when a county applies to us, they are supposed to demonstrate to us that the project is ready right then and there to get going.
So it's shelf ready.
Right, or that in our view of reviewing their application, that it probably will be within 6 months. Well, within every case of every county that's applied, the authority has a discretion to extend that 6-month period. We've extended all of them 6 months, and that extension occurs to April of this year, April 24th or thereabouts. So we're just on the verge of entertaining more extensions because they're all in a state of not actually being ready, where their programs are ready to implement, just because of the explanation that I had given, the various reasons of why it takes a while. Just locally, to get even a piece of property identified as appropriate for a residentially, you know, community-placed program.
Keep up the good work. We look forward to getting those
Thank
bids
you very much.
operable.
Yep.
Thank you.
We shall.
Thank you very much, Senator Stone. Any public comment on the Mental Health Wellness Act of 2013? I ask that you use the floor mic, please. Thank you. Public comment will be limited to 2 minutes, please.
Good morning, Madam Chair and members. Adrienne Schulten with the County Behavioral Health Directors Association. We represent the public behavioral health departments across the state. And first, we just wanted to say just thank you to Barbara Liebert and her staff at CHAPA for being such excellent partners with the counties on the provisions of SB 82. This is the first time that state funding has been provided for capacity programs like this, and they have been working very closely with us, and we're very pleased. And in fact, as was mentioned in the third round of funding, we were very pleased to see that the counties that apply, the majority of them actually did apply for crisis residential programming, including 2 new small counties, including Mendocino and Kings County. We also saw an additional application from San Bernardino and from Sacramento for crisis residential programming. And Los Angeles, as you know, also applied for mobile crisis support. So crisis residential programs take time to develop. There are, you know, local planning requirements, siting requirements, a place needs to be built, remodeled. So that's, you know, that's to answer some of the questions about why some of that funding wasn't applied for initially. And so, you know, the California Mental Health Planning Council in our state has called for more crisis programming, and counties and their nonprofit mental health providers have responded to that. So we do have, as Ms. Liebert mentioned, until June 30th of 2016 to encumber the funding. And so we're working very closely with CHAPA on some of these considerations in terms of how we can maximize the funding going forward, including moving funding across categories, and also including perhaps the provision of peer respite programs. This is a program that's evidence-based practice funded by SAMHSA, works better in rural communities. It's a temporary place where a consumer can go. Sometimes it's 4 to 5 beds. Somebody who's in the ER or headed in that direction where they can go temporarily to get services, again, supervised by the county behavioral health department. So we really look forward to continuing to partner with CHAPA and the excellent work of their staff. Thank you very much.
Thank you. Next witness, please. 2 minutes.
Very briefly, Rusty Seelix, California Council of Community Mental Health Agencies, and just wanted to echo some of the previous comments to indicate how important and difficult this category of funding is. The State Hospital Association 3 years ago did a study that said 2/3 of the people taken to a hospital for a 5150 don't meet the criteria. What they need is one of these types of programs, but they couldn't find it anywhere. The problems are extremely difficult for adults and even more difficult for children. It's rarer for children, but even more important, we find that we hear stories of children being transported hundreds of miles to the nearest psych bed. There's only 9 hospitals, and it's not even the right place for them. So this is a very important program. These are very difficult things to reach, and we think they're doing a great job.
Thank you very much. Appreciate it. Ms. Liebert, thank you very much.
Thank you.
For the update.
Thank you.
We'll move on now to item 4560, the Mental Health Services Oversight and Accountability Commission. We're on page 5 of the agenda. Welcoming Toby Ewing, Executive Director of the Commission.
Thank you very much, Madam Chair, Senators. And I have with me Norma Pate, our Deputy for Administration, and Dr. Renee Bradley, who leads our research and evaluation shop for the Commission. Thank you very much for the opportunity to come and chat with you a little bit. Appreciate the work of the staff. I am new to the Commission as of about 5 weeks ago.
Oh, welcome.
So I may not have all of the answers at the tip of my tongue. Hopefully, we can certainly get them to you if you have questions we can't answer right away. Staff had done a good job sort of outlining the role of the commission in the briefing materials. I think you're familiar with Prop 63 was passed, established the Mental Health Services Act, and established the commission. And among our statutory roles are overseeing the implementation of the act in ways that are recognized by Prop 63, which includes a heavy emphasis on consultation with communities, a heavy emphasis on client and stakeholder and family member perspectives. In addition to that work, the Commission also manages a series of efforts to engage the client stakeholder community in both the state's process as well as county level processes to make sure that the mental health system is responsive to the needs of these communities. And that's based on a history in California and actually in the country where we've not necessarily done as good a job in that area as we need to do in terms of listening respectfully to those communities. Wanted to talk with you a little bit about the questions you had asked were about how we ensure that the Prop 63 funds are well spent. I think, as you know, that's a very challenging thing to do. The Commission undertakes a number of activities, including plan reviews, periodic consultations with the counties. We also hold community forums. We have stakeholder advisory bodies. We have a committee process, all intended to really help us understand what's working and what's not working in the communities. And that's on top of the Commission's direct evaluation work. I don't know the exact percentage, but we do an array of evaluation work ourselves. We also work with academic and institutional partners through contracts to actually do additional investigations and evaluations. I think in our documents we have, 17 ongoing evaluation activities. We have more than a half dozen in a planning process as well, and that's driven by an evaluation master plan that I believe we've shared with you that lays out a set of priorities for the Commission in terms of how to use those limited evaluation and research dollars. Most recently, the legislature gave the Commission, consistent with the conversation you just had, funding to administer the triage program. We administer a series of grants to put in place services in counties that are tailored for the unique needs of individual counties to really try to reduce hospitalizations, involvement with the criminal justice systems, and other kinds of crises that if we don't intervene early, really will result in higher levels of need and certainly higher expense. And how many counties do we have? 24 of the counties that applied were able to get funding. There's a little bit of leftover funds there based on some the delays in implementation. Consistent with the presentation you just had, it has been very difficult for counties to implement this program. And so I think there are 490 positions that are envisioned to be funded through this program, and we're at about 187 of those being filled at the moment. We talk frequently with the counties about the challenges that they're facing, and consistent with what you just heard, some of those challenges are delays at the county's level, like getting approval from the Board of Supervisors. Los Angeles County, I think, received funding for about 185 of those positions, and they just recently got their Board of Supervisors to approve that funding. And so there are those kinds of delays. Some of these delays, however, are much more challenging. And in one instance, a county has dedicated this funds to make sure that there's a clinician available evenings, weekends, and holidays, right? Those times when crises are most difficult to respond to. And as you can imagine, it's hard to find folks who are willing to take that job in a rural county to move to a place with often the kinds of compensation that public agencies can provide. So there are a number of very understandable challenges that counties are facing in moving forward with this program. But the intent really is to put in place a triage opportunity so that we can reduce the escalation of need in ways that are both providing better outcomes for clients and family members and bigger bang for the buck in terms of the state and the counties at the same time. We'll continue to work with the counties to monitor that program. I think also wanted to just share with you, sort of being new to the Commission and really trying to understand what's going on. One of the ways that we're thinking about this is Prop 63 really is a learning policy area. It really is designed to expand the number of services that are available through service funding, just additional funding in general. It's designed to incentivize investment in prevention and early intervention, and that's very unique in public policy, unique here in California, but unique in the nation. And it also has a provision for funding and innovation. And the goal really is that to help the counties understand what works and to use service and prevention and early intervention dollars in ways that really drive public agencies towards evidence-based practices, and then relying really creatively on that innovation fund to try some things where we don't know what works. And through the evaluation component of the OAC, in partnership with counties, through the evaluation efforts that counties have as well, really get into the business of using information to help improve our ability to make decisions about what's working and what's not working. One of the roles of the OAC that we're beginning to develop is to help you, counties and the public, understand where we are in that process. Where are we in the deployment of evidence-based practices? Which counties are experimenting with innovation funds? What are we learning about which of those programs actually are effective? And how do we disseminate that information to counties where they don't have the opportunities for that kind of research? So the commission really is in a position to help you and the public understand how our mental health system writ large is evolving over time. Part of that conversation, and consistent with the questions in the packet, really is to better understand how the state's data systems are enabling us to do that kind of research and evaluation and where they fall short. And so in partnership with the Department of Healthcare Services, with the counties and others, we're working to understand sort of the goodness of fit between the kinds of questions that you have, that we have, that the public has with the information that's available, and to what extent we can take advantage of what we already have in place, where we may need to revise some of those efforts around data collection, how the information is shared and packaged, and how it's made available to an array of decision makers. That process is unfolding. Right now, we're at this very early stage of assessing how best to proceed. And the role of the commission really at this point is we're going to hand this off to healthcare services, because really it's a project that healthcare services would undertake, and that we would partner with them to do that. Happy to respond to any questions you might have.
Senator Stone.
Well, congratulations, Mr. Ewing, on your new post.
Thank you.
And I wish you well. In the past, there hasn't been a lot of good data collection that shows the evidence-based successes of this important source of money. I think you'll agree with me that I think one of the major focuses for Prop 63 money and programs is that we have a very high population of homeless people that have mental illness. We have a high population of people that are incarcerated that have mental illness, and our emergency rooms are burdened, unfortunately, with people that have mental illness, and the hospitals have nowhere to put these people. So I'm hoping that as you begin to measure the success of these programs, that you will emphasize these areas where I think really the Prop 63 money needs to be directed, because these are really the issues that the counties are facing that is really problematic. And what is your plans on getting good data back to us? Because, you know, government often gets accused just throwing money at problems, and I don't like just throwing money at problems. I like to throw money at problems, and I like to see that our money, our taxpayer money, is working to improve the quality of life of people that may be, you know, unfortunately ill or in unfortunate circumstances. So I'd like to hear what your vision is now as the new leader of this department to ensure that those monies are streamlined. And I love hearing early intervention, and I love hearing innovation, and I hope that you'll continue with those themes as well.
Absolutely. Thank you for the opportunity. Clearly, the Act does specify that those negative outcomes and some others, homelessness, incarceration, psychiatric hospitalization, are things that need to be reduced through these kinds of strategies, right? In the past, that's actually been a very difficult conversation in California because the fiscal incentives weren't aligned right. This was a question of asking, counties often saw this as, you know, having to emphasize spending county dollars to avoid a state criminal, you know, Department of Corrections kind of dollar, right? Realignment has really changed the environment because we've done a better job of locating both authority, responsibility, and accountability at the county level. On top of that, Prop 63 really is driven by county priorities. And so most of the money, the lion's share of the money, is actually allocated based on the priorities that counties have, right? So that provides the opportunity that you're looking for. I think what's missing, and I think this is an area where the commission can step into that, is it's been challenging for counties who aren't sure, who don't have the staff and capacity to sort of to track what we know about what works, what we know about what doesn't work. They haven't necessarily had the capacity to do technical assistance and training on their own. They haven't had the funding for that. So I think we're at a nice, the commission's in the right place to actually help guide and shape that, not in terms of telling the counties how to do it, but helping the counties look across the experiences that all of them are having in ways that we can help them learn collectively, because we do have a statewide perspective, because we do receive data and information from them through the kinds of regs that we're putting in place, through some of the reporting that's already in place. On top of that, we are building out this new data system with the Department of Healthcare Services with that intention in mind. And one of the things that we're working towards, and we're doing this in terms of the Department of Healthcare Services, is our capacity to actually have access to the data that the state already has on the mental health system. There's HIPAA compliance and related issues that we have to work through. At the same time, we're exploring our ability to actually partner with other state agencies that also have high-value large data sets, like the Department of Justice or Corrections, where we can begin to map the involvement of the mental health community in the criminal justice system so that we can begin to understand what those pathways look like. What we really want to understand is what are the opportunities to invest in high-quality mental health services where that really is the missing piece that keeps people out of the criminal justice system. There are some folks with mental health needs who are criminals, right? And that's not, that's not the segment here. The segment here is, are we incarcerating people? Are we arresting people? Because we're not able to provide alternate services. When you pick up 911, you don't always get the crisis person that you need for the response, right? And triage can resolve some of that, and we need to understand how well that works. So absolutely, the goal really is to do a better job leveraging the information we have to help improve counties to make informed decisions about the kinds of interventions that have the return on investment that you're looking for, that we're looking for, that they're looking for as well. And I think over the next, it's going to take a little time. This is not something that has been the strength, our strength in the past. These data systems don't interface very well. It's complicated, but we're moving in that direction, absolutely.
I wish you success in your new position.
Thank you very much.
Thank you. Finance? I'm sorry, Senator Monning, you had another question.
Yeah, I do, but,
Go ahead.
okay, thank you.
Finance won't mind.
Thank you. So let me add my congratulations as well, and thank you for stepping up to serve the state the way you are. On page 6 of our agenda, there's reference to the transfer of the Racial and Ethnic Mental Health Disparities Coalition from Department of Public Health to within the commission. And I'm just curious if you're familiar with their work. I know it segues on some of this past conversation. In underserved communities, often the intervention, when you don't have programs in place, the intervention is law enforcement, and it's not early risk identification, stabilization programs, et cetera. So just kind of curious your familiarity with the work of REMCO and commitment to work with them. The budget allocation doesn't look like it's sufficient to meet the needs of underserved communities, but just your thoughts on that.
So the commission currently administers a number of contracts like this one, and so I am familiar with REMCO. I've been familiar with REMCO for probably half a dozen years, and have worked closely with them when I was staff to the Senate as well. So clearly understand their work, agree with the mission. I think that California really has to get a handle on the issues of disparities and equity in these systems. We know from the academic literature that one of the big drivers is poverty. And I think the commission really is in a good place to start to shape that conversation in ways that can have some results. But we would look forward to the opportunity to work with REMCO through some advocacy work the way we have done with some of these other organizations. Clearly, as highlighted here, it doesn't look like there's enough money in the program to do that. But in concept, absolutely would welcome that opportunity.
Great, and I look forward to continuing that conversation with you. And I think we face huge pressures on our budget, and it's not my practice to kind of pick favorites in these oversight hearings or preliminary hearings to our budget votes. But that's one area where I know with Prop 63 funds and ultimately limited mental health resources, a commitment to make sure that we're while there's disparity in communities, there's also disparity in the ability to compete for existing funding. And I think the commission can help bring some balance to those underserved communities who don't necessarily have the resources to be competitive in the grant world. And I know REMCO does have a history, and just glad that you're familiar with their track record and want to be supportive any way we can to making sure that is as successful as possible.
Great. Thank you,
Thank
Senator.
you, Madam Chair.
Thank you, sir. Finance. Leo? Great, we'll open it up to public comment.